Hello everyone, this is the Shientist, and welcome to another edition uh, the molecular storm gauge. This is the audio podcast on the third series around an area focuses around healthcare, health sciences, and health service research. And this series promises hopes to be just as invigorating as the last ones. And hope listeners have found that the first audio that came out in the series exploring an important topic around the another important focus, and today I'm gonna provide a perspective on research and laboratory investigations, and putting in a context and understanding around a link with educational support and guidance, and I also suppose it's important to have a focus around advice and peer support. So I'm going to break this audio and podcast down into a few sections of a little bit of introduction about this topic. Why is healthcare education important? Why does there need to be a focus around it, or why is there a requirement for that to be in keeping with aspects of general healthcare practices? And then I'm going to talk a little bit about how education could be more integrative on aspects of on certain disease and disease archetypes. And then I will provide a perspective on healthcare professionals as advisors, educators, and investigators, and then finally some context around diagnostics and test specialists in regard to how healthcare professionals have different subdivisions of health professionals have different have different focuses in different aspects of healthcare, and how every sort of health professional, and even the patients themselves, have areas of focuses that can be implemented in day-to-day practices or healthcare practices, but there hasn't really been a route of integration in that regard. So I'm going to try and shed some light on that for all you listeners. So again, this is this is the second audio or podcast in this series on the molecular storm gauge, and this is another Ztorm Robotics production. So let's crack on and let's begin. So in the part of the introduction, to begin with, apart from sort of technology, sort of and devices and all of the things that are in and around us, like sort of every day, there are there are obviously constraints and there are restrictions. Even so, with sort of the kinds of technology and the kind of sort of programs and things that are out there, it's still there's still limitations generally in and how they are used or implemented, and also how they and how sort of between sort of patients and health professionals, there would obviously be some differences in how they and how sort of aspects of healthcare is approached or received, and how aspects of healthcare and service is delivered. Now, as part of that, with access to the internet and how certain types of sort of information and understanding around aspects of health and disease can be ascertained through sort of online through online websites and even sort of online spaces, that there are advantages and there are disadvantages. There are and this includes, for example, in the UK, there's the National Health Service, and the National Health Service or the NHS does have sort of its own sort of website and how patients can sort of approach aspects of healthcare depending on what the requirement might be about, or the requirement is. So organizations, sort of support groups, whether actually in the public domain, where patients and professionals can search those sort of organizations out, or and sort of sift through sort of web pages, etc. By clicking in, for example, particular website addresses, etc., and or through social media, for example, particular sort of for example, cancer support groups, and I know, for example, irritable bowel syndrome, type group support groups, or sort of other conditions generally, basically, for all intents purposes, for and general clarity, for every part of the body where there's where organs sit anatomically, there will be potentially support groups of in one way or another for those particular organs. Now, at least in one way or another. So with that in mind, the current concern is that despite the advances and sort of the attempts to integrate aspects of information searching versus knowledge implementation. There is still some there is still susceptibility to misinformation, and understanding can be either too understanding for patients in aspects of different health and disease, can unfortunately still be sort of thwarted and unclear. There's work by a couple of authors actually that highlight that sort of information, including Hugh and the team in 2012, and Meroli and team in 2013, and actually more recently, or at least a publication around this work in the last more recently in the last 3 or 4 years. This was work by Van Dam and team in 2017, and information sort of available or approached via the internet, basically whilst it's out there in the public domain, navigating aspects of healthcare can still cause patients and professionals sort of dilemmas in at least one way or another. So peer support and advice and education for patients with certain long-term conditions, for example, are multifaceted, and where patients would traditionally see more than one clinician or health professional for an aspect of healthcare, patients actually have opportunities now to access understanding and at least get some sort of shared opportunity to share experience, etc., with other fellow patients who might be going through similar things or similar scenarios, and also opportunity to share resources. That being said, though, there is ever more requirement to ensure information and understanding surrounding different focuses of healthcare are not just transparent, but also are sort of inclusive, and so that means that where, for example, if patients have a certain element of understanding around aspects of healthcare, and so do health professionals, it shouldn't mean, for example, that the health professional for example, so traditionally where there might be a hierarchy where patients would immediately take an understanding of the health professionals over, a sort of a patient's, especially if they're going through the same experience or there's lived experience there, for example, that they use that information from patients is sort of sort of not or is not deemed as supportive, for example, versus the health professional, albeit that health professional patients would have to seek out understanding from health professionals ultimately. at least if some aspect of healthcare needs to be intervened or implemented from a practical or clinical perspective. This also means, though, in times that have been perhaps where patients and professionals have been challenged by, it's about having links really between those routine where patients might have routine appointments, so they have a way to sort of if not alleviate aspects of healthcare burden, they also have opportunity to sort of have a communication opportunity to communicate with health professional and vice versa for the patient and for the professional and the patient as well, in both ways, because it works both ways, that actually they learn understanding from each other. And so that context has actually in some relatable examples has been documented by Sivan and Pratt in a paper in 2007, and also in Bailey in 2000 and team in 2018, and Hugh in 2000. Hugh and team in 2012. I now want to move on to the next sort of focus around this, and this is where we're going to question around, like for example, is healthcare education is it important now, and also if it's important, who if it's important, then who should which is it that professionals, for example, should they be part of aspects of healthcare where they can prompt and educate, or even sort of educate or re-educate themselves, but also the patients that they care for? Or is it that the patients themselves should be sort of having their appointments to having appointments where there's an educational component as well, so that they, for example, this may sound a bit a bit forward in some regard, but for example, where patients in their appointments sort of take notes so that they can learn and also get a bit more sort of can realign aspects of their healthcare, so they can by documenting through appointments from one appointment to another, by documenting it should smooth out some of the healthcare that they envisage and they entail. So those are questions that are kind of sub questions and subtype questions, and I'm going to sort of look to answer them as part of this particular section of this audio and podcast. So education and peer support across several areas of healthcare leads to patient empowerment, and in a way, I don't think anyone should be surprised by that. understanding around that has been documented and highlighted by McCarthy and team in 2017, and this has also been conveyed by other authors, for example, Prainsack 2018, and Blomqvist and team in 2010, Hugh and team in 2012, where that author published a few papers around this focus. And so, given there is access to online and video resources, there are these are sort of there's opportunity, or should be every opportunity for more interactivity, interconnectivity between healthcare professionals and patients and professionals, and this then should align aspects of healthcare from both sides, so that on the patient where the patient is looking to get an area of understanding and sort of realigns their aspect of their healthcare with a sort of an educational component that actually then prompts and should encourage empowerment. And on the health professional side, it's pretty much the same, except that there's perhaps an added focus or an added layer, and that is to say that health professionals, with that understanding that they provide and through an educational component as part of their sort of practice, and by the way, what I'm sort of referring to is apart from sort of the research focus, and that entity that is the opportunity for them to have sort of educational consultations as part of healthcare practice, should realign aspects of the professional's continual what is referred to ultimately from the health professional perspective is continual professional development. So so it's a win-win situation when sort of prompted to reflect and contemplate on that. And so then in this context as well, patients in particular health who have particular health complaints or health areas of healthcare that need to be sort of addressed, they should find it advantageous to where aspects of future aspects around future healthcare can be bridged. For example, as I mentioned, health educational consultations. For example, they could schedule. There might be opportunity, for example, to schedule online support with allied health professionals, and again, so that there's an integration to link a remote sort of a remote educational service as part of sort of the clinical practice or the frontline practice that patients are perhaps sort of quite used to. And that sort of context has been highlighted by Prainsack in 2018, and again, patients and professionals having that sort of link online in that context can be it's a win-win situation, again, with regard to empowerment. So with those sort of opportunities, it means then that there's opportunity really where along with the educational aspect, for example, and aspects of clinical practice, or even aspects of non-clinical practice, there is an alignment between areas of healthcare, and actually then therefore those listeners, you'll probably be aware that I've mentioned this before in some ways, that those who are allied health professionals that are traditionally not patient-facing health professionals, that there's opportunity for them to actually sort of gauge with patients, and providing sort of educational perspective as well. And so this is where again, certain types of health professionals, for example, that wouldn't not necessarily be patient-facing traditionally, could be, if there was that sort of alignment in aspects of healthcare more generally. And this is where I'm going to say I'm going to focus a little bit on sort of the laboratory side, the laboratory investigations that are part and parcel of certain aspects of healthcare, and with aspects of different health complaints, and so to facilitate that, or to kind of ensure that there is some of that focus, that means that there should be sort of a quality assurance component to the educational aspect, and also so that certain areas are again, certain areas, not just certain areas of healthcare are aligned, but also that professionals who sort of want to provide that sort of understanding, and for example, they traditionally speaking, they may not be trained as patient-facing health professionals, but sort of want to sort of have that as part of their sort of professionalism or professional development. That opportunity there should be opportunity really for that to be the case, and health professionals and patients should be having more dialogue sort of around that. So with regard to this then, as well, those who sort of work behind the scenes, where certain health professionals are concerned, for example, those who are sort of fulfill test and investigation requests, and look into aspects of disease trends, and sort of verify and authorize certain tests and investigations. In future, potentially, they could find themselves taking on more focuses where the educational element could be brought into sort of their everyday practice, at least in one way or another, and also particularly where, for example, there's a lot of online sort of and I'll use this word quite openly, online support groups, and patients are sort of using those groups to share experience and become more informed, and sort of help make decisions, etc. But the issue has been that at least in the literature, there is those kinds of spaces, and these where sharing understanding is quite one-sided, because it's patients talking to other patients, which obviously it has advantages, of course, but the discussions, for example, and the understanding is kind of sort of that doesn't patients may not get closure to finding particular answers. Now, when sort of health where health professionals are concerned, they could well be also on these support groups, for example, or online spaces, but they're not contributing. And I know I may have said that this before in a previous audio and podcast, so forgive me for sort of repeating or relaying the same understanding. But when it comes to investigations, attested investigations, it is those particular health professionals should sort of explore and explore routes really where they can have a link between those online spaces, or where patients have these support groups, just to understand really what concerns and issues they have around their test investigations, and actually not just that, but also look to address that through aspects of healthcare, and sort of implementing in some way some untapped sort of educational basis or stance, so that patients can actually ultimately benefit and become more empowered to also alleviate their healthcare burden. Now, future research, as far as I sort of checked out the literature, would need to, or should need to, explore also the measuring of measuring the quality of sort of if not sort of the areas of clinical practice, or around areas around workforce. There should be a focus around the sort of sort of educational element as well, and some of that understanding has been highlighted in works by Horrocks and team in 2018, and sort of online guidance, or through online spaces, and bridging in clinical areas of clinical or even laboratory practice and test and investigations, etc. In line with educational support, that should actually be sort of part and parcel of healthcare. There is a potential requirement to also make sure, in one way or another, that there is a quality assurance component to sort of the ways healthcare and aspects of disease trajectory can be monitored and are delivered. So that's some basis around sort of looking in one way or another to answer that particular question: is healthcare education educational? Is sorry, what why is healthcare education important, or is healthcare education important? And of course, it is important, and it should be part and parcel of routine practice. It shouldn't be a case where, for example, if there's shared experience that where patients might be sharing experiences, that they hoard that understanding and they don't benefit either in one way or another. And same with health professionals. So it has to be a case where so that both sort of groups actually are at advantage all the time. They actually sort of implement aspects of what they learn and understand through sort of by joined up efforts and joined up working. I now want to focus a little bit on providing sort of sort of an essence on providing education on disease. So and this will also have a sort of a focus on the laboratory investigations and how that how that can and should or could be more sort of streamlined. Every region of England, and I'm only going to give like the UK perspective really. Every region of England has in the not too distant past have been sort of prompting and asked to produce what they call a focus around sustainability transfer partnerships, or and those are and the abbreviation is STP, which will include plans to or should include plans to secure support general practice and enable areas of healthcare practice to play its part in a more integrative way between healthcare sectors. But where STPs have been discussed and highlighted in the literature, it does normally more or less focus around primary care or community medicine. And that being said, though, the effect will allow by having an integration by having sort of those STPs in place, the effect will allow healthcare professionals document and record aspects of care in a more sort of in a more encouraging manner, and so that way it should in effect reduce the need for sort of unnecessary sort of unnecessary aspects of healthcare, where, for example, patients and other professionals where patients might have to go from one healthcare professional to another, for example, they actually can stand to sort of bridge focuses to the point where current practices are become a bit more approachable as well. So some of that context is in a report by NHS England, and it's a 2020 publication by NHS England, and potentially in one way or another, health professionals, again, who would not normally be patient facing or frontline, could be involved, providing understanding around certain disease trends, for example, and linking that to sort of e-health, or sort of what I like to, I guess, refer to is sort of the educational support aspect that can be part of the patient's healthcare record. So that's some sort of understanding, really, some underpinning understanding around education on disease trends, and STPs, sustainability transfer partnerships, can and should really allow the opportunity where, for example, there's links between not just health sectors, but different health professionals, different patients as well, and just actually brings on an inclusivity, sort of the involvement aspect around healthcare, and of course brings more diversity into aspects of healthcare, and where healthcare for sometimes unfortunately has a sense of sort of monotony, and that needs to kind of aspects around that can be sort of alleviated by having again a more sort of an educational component as part of healthcare more generally. So, but what about sort of health professionals as advisors, educators, and investigators? Now, generally speaking, all health professionals, in one way or another, have sort of where the banner on all of those, on all three of those entities, are really and truly, but they may not implement aspects of those three different banners on sort of on a day, on as part of their sort of routine healthcare practices. So that being said, there are sort of criteria between healthcare sectors in one way or another, that guidelines to sort of where patients might need to request understanding, or for example, educational support, or advice. There should be that opportunity for them, and excuse me, the need for hospital clinics, and even clinics out in primary care, for example, that there should be, or could be, a way for patients to approach that in a different in a more dynamic in a more dynamic way. Some of that understanding, at least with regards to sort of in tests and investigations, for example, have been highlighted by in a paper by Crinson and team in 2010, and there are more recent papers. Primary care records are generally not they're not really accessible to those health professionals in secondary care, and listeners might be aware to some extent that health professionals between the two between two health sectors have often had where there is communication between healthcare sectors from one profession to another, that might be the case, but the actual technologies and aspects of patient care, more specifically when documented, the sort of systems that are used, for example, etc. On there can be lapses in communication on that from that perspective, and so that is definitely one area that has been a problem between health sectors for quite some time. And so organizations, maybe whether there's a sort of support groups, or whether there's sort of those other organizations out there that sort of work that sort of focus in between different health sectors, they can that there is potential space really where or at least there seems to be where that between the health sectors would probably make sense in some way or another to link with and integrate some aspects of the service delivery and education, the educational aspect with those sort of organizations that are focusing around different different aspects of health and disease. As I said, for every part of the for every organ anatomically situated, there is potentially and some sort of a support group or organization that sort of looks to bring about aspects of awareness in one way or another. So there is opportunity for that to happen, and in some contexts I'm probably not adding anything new here, but I do want to highlight that that is exactly where sort of different health professionals should sort of envisage sort of being able to provide a sort of support from an educational perspective. And by, if that happens, if that sort of thing is encouraged, then that can bridge the sort of accessibility between health professionals and health sectors in a more perhaps potentially more proficiently. Consequently, though, as well, telephone calls and sort of referral letters that sort of document aspects of the patient's healthcare are sort of are pretty much the principal means, or have been the principal means of communication between between health sectors, and whilst there's been advantages around that, there's time lapses or lag between between health professionals communicating with one another with aspect to a patient's care plan, and then actually a lapse between the patient actually receiving an area of healthcare in following. So by having the educational aspects more integrated into sort of the healthcare service delivery, it in some way, although I probably I wouldn't in some context I would say that in some way or another it should prompt a sense of urgency between health professionals to get that aspect of healthcare and health service delivery into aspects of patients' care, and sort of take that focus a bit more seriously, because then the patients and professionals, as I mentioned before, it's a sort of a win-win situation. And then the processes are generally a problem, because processes can lead to sort of lags in sort of milestones and things like that, and then cause inadequacy in aspects of healthcare. And the focus around that has actually been highlighted in some way, and again, the educational perspective by author Galbraith and team in 2018, resulting in so the processes, as I mentioned, can often lead to sort of inadequacy around aspects of healthcare, and that can result in miscommunication to patients, and in insufficient guidance and sort of provision more longitudinally. And that's where healthcare, where aspects of healthcare, because the healthcare services are sort of fragmented. That's also why there is only sort of finite examples of sort of best practice or practice or areas of excellence in practice. And then in relating that, I just want to highlight again that again, I did some reading around the renal patient support group, the RPSG, which I have mentioned in previous audios, and where they've sort of worked quite hard, I think, to evidence aspects of different focuses around kidney care, for example, or nephrology practice, and best practice relating to CKD, chronic kidney disease, for example, and test parameters, analyte sensitivities, and diagnostics are developed really between nephrology teams, at least from the literature and what I've read, that context is then shared electronically between health sectors, or it should be, to ensure correct and timely referrals, for example, between one health sector to another, and when absolutely necessary. Understanding around this context has been published by Bath in 2012, and actually more retrospectively by Calra in 2004. And healthcare teams generally at present have kind of struggled to understand sort of the I don't want to say, I don't want to brush everyone with the same, or tarnish everyone with the same with the same brush or context, but to say that suffice to say that there is a present struggle to actually link aspects of educational support and in areas of kidney care practice, and if not in adult nephrology, in aspects of pediatric nephrology, for example. On this basis, for example, if everything was as it should be, for example, then for example, there wouldn't be kidney kidney care or nephrology sort of support groups for kids online, where there's where the membership for people who are where there are children or young people online, or part of social media groups, for example, that there's growing membership or increasing membership in those particular groups, and if everything was as it should be, then that those particular social media groups or online spaces, they wouldn't have a growing membership. So and perhaps I could be I stand to be corrected in some way, but the kidney disease and the kidney disease and renal support group, or KDARS for kids, for example, is an example of best practice in that context, and at least in what I've sort of looked at, and around the evidences around that particular support group, and it's still quite in a way quite baffling why why certain aspects of healthcare, and sort of the questions and the conundrums that are being brought up in such online spaces or support online spaces or support groups are highlighted. So there is still a present struggle around aligning that. Patients and professionals, I would think, would want to understand how better, really, or how smarter at least, CKD, chronic kidney disease classification and severity are a focus, or become more of a focus, where educational support is also part and parcel of day-to-day practice. Because what listeners have to sort of appreciate to one extent, or to an extent, at least, is that, for example, in healthcare practices, there's where healthcare professionals, they generally have focused on focused whether it's related to pediatrics or young people, or in adults with particular conditions or healthcare complaints, etc. They focus more so on things like rather than the educational support aspect, they focus more on the clinical trial aspects. And I'm not saying that shouldn't be part of healthcare. Of course, it should. But what I'm saying is that there's if those aspects were to be compared against, there's going to be more around investment and understanding around the clinical trial aspects, more so than the educational aspects, and that's dare I say it, that's pretty much where where there's always been sort of a misnomer and crises, and so that's where things should actually be more aligned. I'm now going to highlight a little bit of focus around the diagnostics and investigations, and then I'll draw this this audio and podcast to a close. So owing to the different kinds of diseases out there, long-term conditions, and I mentioned chronic kidney disease, for example, and how there are other factors that have an impact on disease state, including, for example, socioeconomic status, age, gender, and ethnicity. Those things also, where demographics are concerned, there may be more patients, for example, or even health professionals who provide who look to provide aspects of healthcare on one way or another. There might be for example, in one way there might be privileges in one way, but in another way there might be disadvantages and this sort of a disalignment in actually where there should be sort of equality across sort of all aspects of healthcare. And I'm not saying that that's sort of that I'm not saying that there isn't a sort of a strive to kind of bring things to a place of more to kind of offset that disparity in aspects of healthcare. But I am saying that it could well be, it could be smarter, and it could be better. And this is where a sort of allied health professionals and those involved in different aspects of healthcare, for example, physiotherapy, those in doing, like, for example, the tests and investigations, those who are doing the aspects of nursing and nursing practice, and those who are doing sort of the just general areas as well, and even in areas where health professionals are very patient facing, for example, but they just do not have either there's time constraints, or it's that their for example, their job description does not require them to be very patient facing, for example, that could that should actually should also be looked to be streamlined in a way that patients benefit from expertise, perhaps, if not in a physical space, more so in an online space, and that should really bring more integrity integrity to aspects around healthcare in that way as well. So there are so I mentioned this in a previous podcast, but on audio in the before, but just to highlight that point of care testing initiatives have been developing owing to clinical need between health sectors. That being the case, the skill sets required to provide accurate and decisive service requirements. Service requires a sort of mixed skill base, and I'm sure listeners are familiar with that in some way or another, but it is considered important, or it should be important, that wherever point of care testing is operated, or there is that functionality, it must be monitored and be supervised by qualified staff, for example, those who are accredited from areas of, for example, laboratory practice, where they are familiar with aspects of quality assurance and certain aspects of calibration and calibrating sort of point of care testing, sort of kits, etc., so that patients who might find it challenging to, for example, meet aspects of healthcare on in one health sector versus another, that they at least can sort of go to certain areas to have tests and investigations done, and those test investigations are still have that there's assurance and validity around that, so that what happens in on a kit, on a test kit, versus what happens in a main laboratory, for example, that there is an alignment around that. So apart from that, health professionals could generally communicating or highlighting that it could be involved in sort of the quality and the accuracy of sort of areas of healthcare practice, linking in aspects of healthcare education as well, and so thus to ensure the translation of sort of understanding and context that comes out from educational support, so that health patients in different areas of health and disease actually stand to benefit much better, and therefore and thus basically ultimately patients are sort of take ownership, and there is that sense of empowerment, but also they generally will have more positive experiences around healthcare, and some of that context has been highlighted in a paper publication by Beastall in 2008, and one particular paper I would I'm going to make a couple of recommendations on some further reading, as I have done in previous audios or podcasts, but I would just give out the main author, sort of main authors, and if you put these into the search engine, you can actually find should be able to access these paper publications. It shouldn't be a problem. So there's Ztorm in 2008. There's a paper by Rainey and colleagues in 2020. Rainey spelled R-A-I-N-E, and that's in 2020. And there's Stoves and team in 2010, and there is Crinson, as I mentioned before, in 2010. There's Barth, that's B-A-R-T-H in 2012, and there's Hardiker, that's H-A-R-D-I-K-E-R, and team in 2011. And again, there's the NHS England 2020 report, and there is, oh yeah, of course, there's Blomqvist, Blomqvist in 2010. That's B-L-O-M-Q-V-I-S-T, and it's 2010. And there's Hugh H-U-H, and team in 2012. And there is a paper by Plebani, a couple of papers actually by Plebani, that's spelled P-L-E-B-A-N-I, in 2016, and in 2017. And Plebani is a Italian author that focuses on sort of the more intricate entities around nephrology, around tests and investigations, and actually the different sort of focuses scientists and other allied health professionals have in and around between healthcare sectors. So I'm going to draw this to a close now. I want to say thank you for listening, and for tuning in on this, and listening to this particular audio and podcast. And again, just to remind you, there's been another Ztorm Robotics production. Thank you for listening.